All right, today we're talking about an antibiotic that millions of us have probably taken at some point. It's a real workhorse, a go-to for doctors when they're fighting off serious infections. But what if I told you it has a hidden dark side, a really serious risk that's only now starting to get the attention it truly deserves?
Yeah, I know. It sounds pretty extreme, right? A common antibiotic leading to a coma? But this isn't just some hypothetical. This is a real question, and it's backed by an official FDA safety warning. A medicine that's supposed to make you better can, for some people, cause a catastrophic drop in blood sugar. So, how on earth does that happen? Let's get into it.
To really understand this, we're not starting in some high-tech lab. We're starting with a person, a perfectly healthy 28-year-old guy. He gets a routine infection, gets a common antibiotic, and what happens next is anything but routine. It's a total medical mystery.
Just look at this timeline. It's just terrifyingly fast. Day 1, everything's normal. He picks up a prescription. By day 4, blurred vision, sweating, the warning bells are already ringing. And then, boom. Day 7, he's unconscious, rushed to the emergency room. But that's not even the end of it. The ordeal goes on for weeks. Can you imagine having to eat every 2 hours, not because you're hungry, but just to stay conscious? This wasn't some mild side effect. This was a full-blown, life-changing crisis. So, okay, what was the drug that caused all this chaos? The culprit here is ciprofloxacin, a name you might have heard before, maybe you've even taken it. Let's dig into what this stuff actually is and why doctors prescribe it so often. All right, so ciprofloxacin is part of a family of antibiotics called floroquinolones. And these are the big guns, you know? They're not just messing with bacteria, they're going straight for the kill. They basically shred the bacteria's DNA copying machine. If bacteria can't copy their DNA, they can't multiply. Game over. It's a super effective way to just wipe out an infection. And there it is, the molecule itself. You're looking at the chemical structure. That specific shape is what makes it so good at its job, a brilliant bacteria killer. But here's the twist. That same exact shape has a flip side. It can accidentally fit into locks in our own bodies. And that's where the trouble begins. That's the key to this whole thing. And this is why this is such a big deal. It's about how incredibly common this drug is. I mean, look at this list. UTIs, pneumonia, skin infections, even bone and joint infections. Cipro or ciprofloxacin is prescribed for all of it. So we're not talking about some obscure drug for a rare disease. This is a go-to, a real staple in the medical toolkit. Okay, so we've got two pieces of the puzzle, right? We have this guy's terrifying story, and we know the drug he took is super common. So what's the connection? How does an antibiotic, a bacteria killer, end up causing someone's blood sugar to just completely bottom out? Well, science finally found the smoking gun. Deep inside your pancreas, you have these little channels that basically control the release of insulin. Think of them like a dam. And what researchers think is that this antibiotic can come along and jam the floodgates wide open. The pancreas gets tricked into dumping a massive amount of insulin into your system, way more than you need. And when that happens, your blood sugar just crashes. Now think about this for a second. If you're a patient with diabetes, you might already be taking insulin or other drugs to lower your blood sugar. Adding Cipro on top of that, it's like pouring gasoline on a fire. It can take a controlled situation and turn it into an absolute crisis, a dangerously severe hypoglycemic episode. So you have to wonder, right? Was that 28-year-old guy just incredibly unlucky? A complete fluke? Or was his story a red flag for a much bigger problem that nobody was really talking about? To get an answer, scientists went digging in the World Health Organization's massive global database of drug side effects. And what they found in that database, Vigibase, is pretty eye-opening. Now, to be super careful, they filtered out anyone who already had diabetes. They wanted to see this effect in non-diabetic people. And they found 35 crystal-clear cases from 17 different countries. And get this, the median time it took for things to go wrong was just 4 days. Sound familiar? That's exactly what happened to our 28-year-old. And that last stat is the real kicker. In almost half of these cases, Cipro was the only drug they were on. That makes the connection pretty hard to ignore. Yeah, and we're not talking about a little dizziness here. Out of those 35 cases from around the world, 20 of them were officially marked as serious. And when they say serious, they mean it led to hospitalization, a disability, or was genuinely life-threatening. And for 2 of those patients, it was fatal. They died. That's the absolute worst-case scenario right there. It shows that while this might be a rare side effect, it can be an absolutely deadly one.
Okay, so this is super important for everyone to know. You need to be able to recognize the warning signs. Low blood sugar, or hypoglycemia, feels a certain way. You might get shaky, sweaty, confused. Maybe your heart starts pounding. It's totally different from the symptoms of high blood sugar. Just knowing what to look for could be a literal lifesaver.
So you've got these individual patient stories piling up, you've got the global data. Eventually, the big regulatory agencies had to step in. And in 2018, the U.S. Food and Drug Administration, the FDA, finally made a move. They issued a big safety announcement.
And look at this quote from the FDA. There's no mincing words here. They say it flat out. Low blood sugar levels can result in serious problems, including coma. And notice who they specifically call out: older people and, this is crucial, patients with diabetes. Why? Because those are the folks who are already on drugs like insulin that are designed to lower blood sugar. So the FDA is officially recognizing that dangerous interaction we talked about.
And this wasn't a small tweak. The FDA went big. They made the company add hypoglycemic coma right there on the warning label as a possible result. And it wasn't just about blood sugar. They also used this opportunity to beef up the warnings for mental health side effects. Things like confusion, memory problems, even delirium, across this entire class of antibiotics.
All right, we've covered the case study, the science, the global data, the FDA warnings, the whole story. But now let's get to the most important part. What does this actually mean for you, for me? How do we take all this information and use it to protect ourselves and our families?
Now, it's important to put this in perspective. Not all the antibiotics in this floroquinolone family are created equal. If you look at this chart, you can see that some others, like moxifloxacin, carry an even higher risk of causing blood sugar problems. Ciprofloxacin is actually on the lower end for its class. But, and this is a huge but, lower risk is not the same as no risk. As the story of the 28-year-old shows us, even that lower risk can be absolutely devastating. So, who really needs to be careful? Well, the data is pretty clear. The risk goes up if you're over 60 or if you have kidney issues. But the biggest red flag, the group most at risk, is patients with diabetes, especially if you're taking insulin or other drugs to control your blood sugar. You have to remember that potential interaction. The antibiotic can basically supercharge those other meds, creating the perfect storm for a dangerous crash. Okay, so let's boil it all down to 4 simple, practical steps you can take. First, inform. Tell your doctor everything, especially if you have diabetes or kidney problems, before they even write a prescription. Second, recognize. Know those symptoms of low blood sugar we talked about, the shaking, the confusion. Third, monitor. If you have diabetes and your doctor puts you on one of these, you might need to check your blood sugar more often. Be vigilant. And fourth, and this is the most important, report. The second you feel any of those symptoms or any weird changes in your thinking, call your doctor immediately. Do not wait. And all of this really leaves us with a big lingering question, doesn't it? The story of Cipro is just such a powerful reminder that even the medicines we use all the time, the ones we trust completely, can have these rare but incredibly serious hidden dangers. And it makes you wonder, are we all, doctors and patients, really doing enough to stay on top of this stuff? To constantly ask, is the benefit of this drug still worth the risk?